Go.
Great. Okay, great. So, first of all, thank you for taking some time out of your lives to learn about nutrition and how your bodies work. I haven't given this talk in a long time, so this is going to be a lot of fun. I'm going to ask you a question first before I get started. What are the things in the body that affect the autonomic nervous system? What are the things that we do, or the things that can affect autonomic nervous system function? And maybe I should even ask, what is the autonomic nervous system? Maybe we should ask that first. Can anybody answer that question? Well, some of you people that have been to my talks ought to be able to answer that. What is it? The autonomic nervous system is the part of our nervous system that functions subconsciously when we don't even think about it. Does anybody think about their heart beating?
No.
Do you think about digestion? No, that's the autonomic nervous system. You breathe automatically, that's the autonomic nervous system. So what are the things that affect the autonomic nervous system? So this talk tonight, what I'm trying to do is just change your thinking about some things. What affects the autonomic nervous system in our lives? Stress. Good answer. I would say unmanaged stress, but yes. Very good answer. Okay, very good answer. So we got one right here that got one of them right. Okay. What else? What else affects the autonomic nervous system?
Alcohol.
That wouldn't help it, that's for sure. We'll just do a sweeping thing and say diet.
Yeah.
What we eat.
Okay.
Okay. Yeah. So what we eat. Okay. What else affects the autonomic nervous system? Has anybody in here ever heard of chiropractic? Okay. So being subluxated, having nerve interference is a primary thing that affects the autonomic nervous system. So whenever you come in here and I adjust you, we're affecting the autonomic nervous system. And so if you come in and you have no pain when you come in, and I adjust you and you don't feel anything, that doesn't mean nothing happened. That just, we have just reset your autonomic nervous system. So those are three things. One more that we're going to talk about that I just want to mention. It's not part of the talk tonight.
Sleep.
Exercise.
Yeah.
Exercise affects the autonomic nervous system. So we're going to be talking about more of the nutrition and the inflammation portion tonight. So what is inflammation? Well, inflammation is a biological response to something that happens in your body that your body basically doesn't like. It's a protective response. It involves immune cells. Anybody in here ever heard of the term cytokines? Cytokines are the molecules that are basically the language of your immune system. So it involves immune cells, blood vessels, and molecular mediators that really control all of this. So the purpose of the inflammation is to eliminate the initial cause of injury. So has anybody ever sprained their ankle real bad? I mean, I have. Yeah. So what happens? Swells up. That's inflammation. So that's your body's way of trying to protect you from re-injuring yourself. Okay. Now, inflammation is a good thing in that regard. It can be bad, like if you injure your eye. You don't want too much inflammation because that can actually damage the structures of the eye, so you can't see as well. So that's when you have to control it. So inflammation is basically when it's a proper effect in your body is to help you respond to something that's negative and to keep worse things from happening. So what lifestyle factors cause poor inflammation or bad inflammation? So there's good inflammation, like anybody ever hit their finger with a hammer and it swells up?
Yeah.
That's a normal response of the body. But if you carry around inflammation and you haven't done anything, you haven't hurt yourself, that's not good inflammation, okay? That's what we're going to be talking about tonight. So what lifestyle factors cause inflammation? So stress, uncontrolled stress cause inflammation. Diet, a diet high in refined carbohydrates inflames your body, okay? Now I know nobody in here would ever eat that kind of a diet, but there are some people out there that do, okay? Smoking causes inflammation. And I don't care if you have a perfect diet, you take perfect supplements, you get adjusted. If you smoke, you're going to have inflammation, and it's going to show up on blood work. Sleep deprivation, okay, which, that reminds me of my 4 years at college. We had a lot of sleep deprivation. You probably had some too, didn't you? Staying up half the night, studying for an exam, or writing a paper, or just having too much fun. That's another thing that happened in college. So sleep deprivation causes inflammation. So let's look at chronic inflammatory syndromes in the body. So number one, obesity. If you're overweight, you're carrying inflammation. Arthritis, fibromyalgia, atherosclerosis, which we can measure pretty well on a blood test. Type 2 diabetes, any autoimmune condition, GI inflammation, leaky gut, cancer. If you've got cancer, I promise you've got an inflamed system. Why is our diet so important? This is really going to put things into perspective. So we get a new liver every 5 months. So your liver cells turn over about every 5 months. Okay. So why is it? Now this is a really good question. Why is it that somebody can have chronic liver degeneration and chronic fatty liver for years and years if this happens? Why is that?
Because of their diet? The stuff that they're eating is affecting their liver.
Yeah, if you're eating, what causes, by the way, what in our diet causes fatty liver?
Refined sugars.
Refined sugar, especially fructose. Fructose is the number one cause of fatty liver. So like eating lots of high fructose corn syrup, foods like that, causes fatty liver. That's why we're getting fatty liver in kids, because kids are eating this stuff, okay? In the 80s, if you go back to the 80s, it's when I started practicing, the only people that had fatty liver were people that drank too much alcohol, because that's the other reason for it. Now we've got kids that are growing up on high fructose corn syrup that have fatty livers by the time they're 10. And it's a lot more common than what you think. So we get new skin every month. We get a new stomach lining every 4 days. Lung tissue turns over every 2 to 3 weeks. So can we really make healthy tissue and organs from junk food? No. You're not going to make healthy tissue from Cheetos, okay? It just can't happen, all right? So which foods tend to cause inflammation? Well, some of you guys know the sugar and grain are refined wheat products for sure. They raise insulin levels, they cause insulin resistance. Elevated insulin causes the production of pro-inflammatory chemicals in the body, which is why I like that test so much on the blood work that I do, is insulin, because it tells me a whole lot about what's going on in a person's body. Insulin's a fat storage hormone, so it locks fat into cells. Sugar has a similar chemical makeup to vitamin C, so it competes with vitamin C to enter the cells. So that's why when kids or even adults eat a lot of sugar and they always got colds, because they're competing with vitamin C. You can't do that and stay healthy. Elevated insulin decreases the cellular uptake of magnesium, resulting in increased blood pressure and muscle spasms. Some of the effects of elevated insulin: age you rapidly, and they increase your risk for cancer. I go into that a lot in the cancer talk I do. Elevated insulin causes the body to dump calcium into the urine, increasing the chances of osteoporosis. So when you eat a lot of sugar and your insulin's always high, you're throwing out calcium, and it goes out in the urine. Here's one. I just had a conversation with a young man not too long ago. In men, elevated insulin converts testosterone to estrogen. Okay, so in men, elevated insulin makes men into women, turns men into women, basically. I mean, if you're a guy, that's not much fun. Okay, so it's not good for men. And high intensity aerobic exercise and weightlifting is one of the things that lowers insulin levels, along with diet. Okay, so the other thing, fatty acid imbalances cause inflammation. So too much vegetable oil, like Crisco, corn oil, safflower oil, peanut oil, sunflower oil. Wesson. Yeah. Any of these, okay. So eating cold water fish, sardines, great way to get omega-3 fats. Flaxseed, if your body is able to convert it, is very good, okay. How do we measure cellular inflammation? If we want to measure the silent inflammation, which just sort of takes people over, one of the best measurement is the fatty acid test that we do. It's the arachidonic acid EPA ratio. This ratio should be about 2 to 1. In most Americans, it's about 20 to 1, 30 to 1. If you look at somebody who has, and we're going to cover this in just a few minutes, if you look at these people that are very violent, very angry, they have ratios up 75, 85 to 1, because it really affects your brain and your mood and how you behave after a while. So eating trans fats causes inflammation. So, I've talked about this before, but if you look at all these lists that you can find online of the worst foods, usually you'll always find French fries in that list. They're so bad for you. They taste so good, I know. They are so bad for you. So trans fats elevate your cholesterol, and they create inflammation in the body. So, when I was a kid, and I just choke about this. Now, we used to eat margarine growing up until we learned better, Yeah. Now, I eat butter, and I eat a lot of butter. I put it in my coffee. Butter's a really pretty good food. Signs of essential fatty acid imbalances. So if you carry inflammation, that would be one. If you consume the standard American diet, you definitely got it. Dry, flaky skin, hair's dry and dandruffy, decreased memory, psychological problems, depression can be a sign of fatty acid imbalance. Why is this the case? Why is that? Some of you guys that have been in my talks, I know the answer to that. Why is that?
The outer part of the cell is fat.
That's true.
And so the bad fats, they make that outer covering hard.
That's true.
As I've learned.
And you can't pass anything in and out of the cell.
Toxins can't get out, nutrients can't get
in. Right. That's true.
But the cells, they can't communicate.
Can't communicate, right. But here's the other thing. What are our brains made out of?
Made out of fat.
Our brains are basically a glob of fat.
Yeah.
Okay? Very organized fat, but a glob of fat. So if you have the wrong kind of fat in your brain, isn't that going to make a difference? Yeah, it will. Right. Okay? Now I'll show you some studies here in just a minute. Decreased immune response. You get sick easily. That can be a fatty acid imbalance. Increased cholesterol and serum lipids. That's one. So if you're eating a lot of the wrong fats and your cholesterol's really high, it's probably the reason. Okay, subluxations are a source of inflammation in the body. And you can really tell when that's been there for a while because you see these degenerative vertebra, degenerative disc disease. You see arthritis, spondylosis, all kinds of things you see when that's been there for a while. And here's the thing, is that you can have a subluxation in your body, in your spine for a long time and not even feel it until it's caused a lot of problems. I see that all the time. In fact, if somebody comes in, and I pretty much, somebody's got lower back pain, they're going to get their neck x-rayed as well because the neck and the lower back are so well connected. I see people that come in have low back pain, I x-ray their neck, they've got all kinds of degeneration in their neck, they didn't even know it. They got phase 3 degeneration, had no idea, because it can be there for a long time before you really even realize that cancer and heart disease. So subluxations cause inflammation. So abnormal mucosal barrier, the barrier around the gut lining of your intestine, small and large intestine, is a cause of widespread inflammation. I would say this, that the vast majority of people walking around, if you just did a test on air, took 20 people off the street and did a gut function test on them, you would find leaky gut probably in all of them. It'd be very rare not to find it. So what happens, I'm not going to spend a lot of time on this, but when the gut starts leaking, all kinds of things leak through into the bloodstream, and your body that shouldn't be there. Your bloodstream's not like a garbage dump, okay? Your bloodstream carries around nutrients and oxygen and things like that. And so when things get in the blood that shouldn't be there, your body recognizes that and creates an inflammatory response. So what are those things, some of the things that cause leaky gut? Well, food intolerances, okay? Excessive alcohol for sure. A lot of food additives, and a lot of pharmaceuticals. Lots of pharmaceuticals cause leaky gut. So if you're taking multiple drugs, multiple pharmaceuticals, chances are, your gut's leaking, and that may be causing some issues for you. And think about this, if you take, let's say you're taking 2 pharmaceuticals, okay? If you add a third one, now you don't know whether you're treating side effects or not. You add a fourth one, what's causing what, okay? And you start adding pharmaceuticals to that, what happens is you're depleting your body of vitamins and minerals, because all pharmaceuticals do that. And the second thing is they start causing leaky gut, and your body starts reacting to that. And you go to your physician, what's he going to give you? More pharmaceuticals. Okay, so it just becomes a cycle. All right, so you got to be careful about that. Additional causes of leaky gut. So bacterial and infections in the gut. I just had a patient come in to see me a couple of days ago. She got under a lot of stress, and then she had some antibiotics that she needed to take, and she came into me with a full-blown yeast infection. She goes, "What do I do?" She says, "I don't want to take any more drugs for it." So I gave her some herbal products that kill bacteria, or that kill yeast. Can you guys think of one product that kills yeast?
Garlic.
Garlic. Good job. Garlic kills yeast. That's one of the things I gave her. It's garlic product we carry. Some other things kill yeast too as well, like oregano oil will kill yeast. But yeah, so I gave her some things that would kill that, and that would take care of that for her. Some nutritional deficiencies, low stomach acid causes leaky gut. And as we get older, our stomachs don't produce as much acid as and you need, it's kind of a weird thing. You need zinc to produce stomach acid, but if you don't have enough stomach acid, you can't absorb zinc. So what's the solution to this? What can help this? Nobody knows.
Eat more meat. I'm thinking zinc, zinc's in pork.
So that's true. So one of the things that can help that is to help your stomach along. So at night, after you've eaten, or you can do this after lunch too, take a tablespoon of apple cider vinegar and chase it with water.
Okay.
That will help. Okay.
Yeah.
That will definitely help your stomach digest the food better. So you can do some things like that. That's cheap. Doesn't cost hardly anything. I mean, apple cider vinegar is not that expensive. And that can help you digest your food better. 9 signs that you may have leaky gut. So your typical gas, bloating, diarrhea, irritable bowel, seasonal allergies or asthma, hormonal imbalances, PMS, PCOS, any autoimmune disease. If you have any autoimmune disease, I promise you've got leaky gut. Absolutely you got it. That needs to be fixed. You cannot fix autoimmune disease unless you fix leaky gut. Important point to remember, most of the systems in your body are downstream from your GI tract. Okay, so if you've got gut issues, a lot of times those need to be fixed because that's such a potent area of inflammation in the body. So any diagnosis of chronic fatigue or fibromyalgia usually indicates inflammation. Mood issues, we're going to talk about that in a minute. Skin issues, candida overgrowth, certainly. Food allergies or food intolerances, which pretty much everybody has some. So how do you know for sure if you have leaky gut? Well, the definitive test that I use is the Wheat-Zoomer test. That shows whether, first of all, it shows whether your gut's leaking, how bad it's leaking, and also if wheat or gluten or wheat germ oil or anything associated with wheat is causing it. It's a great test, and I really like it, that test a lot. So one of the things that this test tests for are these transglutaminase proteins. So if number 2 comes up, that means you have an autoimmune disease of the GI tract. If number 3 comes up, you have an autoimmune disease of the skin. And if number 6 comes up, you have an autoimmune disease of the central nervous system. And it all comes from gluten, okay? And I think these probably follow along maybe genetic lines. Maybe genetically you have a tendency towards one or the other. So what's the solution to this? You got to get wheat completely out of your diet, and we have to fix the gut. So how do you correct leaky gut? Well, you eliminate the foods that are offending them, that are, so we've talked about that. You need to kill off any infection in the gut, and then repair it with nutritional formulas. So I want to talk a little bit about depression, Alzheimer's, and inflammation. So an inflamed brain can cause an inflamed body, and an inflamed body can cause an inflamed brain. So your brain has cells that respond to inflammation called the microglia, and they determine whether your brain is inflamed or it's aging too quickly, okay? So one of the biggest risks to activating the microglia in the brain or creating an inflamed brain is a leaky blood-brain barrier. So what could cause a blood-brain barrier? Again, think about the chronic stress that's not controlled. Too much alcohol, elevated blood sugar that's too high, vitamin B deficiency, especially B12, B6, and folic acid, toxic exposure to environmental toxins, which we're all exposed to, subluxation, previous head trauma, lack of oxygen from poor circulation, and dietary gluten. low brain antioxidant status. So all of those things can cause a leaky blood-brain barrier. Here's the symptoms of a brain that's inflamed. Brain fog. Anybody know anybody like that has brain fog? Depression, unclear thoughts, low brain endurance, slow mental speed, loss of brain function after trauma, brain fatigue and poor mental focus after meals, brain fatigue caused by chemicals, scents, and pollutants. Okay, that's out of a book called Why Isn't My Brain Working, which is in my library. So let's look at the link between depression and inflammation. So if you take anybody that's got chronic depression, I promise you, absolutely promise you, they've got chronic inflammation in their body that's spilling over to their brain. So here's some interesting articles out of journals. This is JAMA Psychiatry. Compelling evidence suggests a link between depression and inflammation. Here's one, Archives of General Psychiatry. Elevated levels of C-reactive protein, which is an inflammation biomarker, may be associated with an increased risk for depression, new research suggests. Here's Current Opinions in Psychiatry, 2009, that the literature supports the fact that depression is associated with inflammation. And they look at the elevated C-reactive protein, which I do HS, high sensitive C-reactive protein, on my lab tests. And I find that high in a lot of people. So how do we test for blood-brain barrier disruption? We have a neural zoomer test, which shows a lot of things that can be happening in the brain. So how do we reduce inflammation? What is it about our diet? So whole food diet. Okay, anybody in here eating a whole food diet? Anybody trying to eat a whole food diet? Okay. Do you have any whole food in your diet? Maybe I should ask that.
Yeah.
Okay, so yeah, keep alcohol to a minimum. Avoid exposure to toxic metals. So you don't want to cook in aluminum if you can help it, or cook food on top of aluminum foil.
Yeah.
Okay, you're going to get aluminum like that. Test for and repair dysbiosis and leaky gut, which is a major source of inflammation. And get 7 to 8 hours of good sleep, okay, if you can. All right. Regular exercise, really important for lowering inflammation. So consume nutrients which heal the gut. Now I have a whole gut healing protocol that I use here in the office for this. And we use a lot of this gut flora complex, berberine, boswellia. We use fish oil. Green tea is a great adjunct for helping your gut. So I drink green tea every day, especially in the winter. We consume a lot of it at our house. I also drink coffee, by the way, but I drink green tea a lot. Okay, very good for gut health.
What is berberine?
Berberine's an herb, and it's an herb that when you take it, it kills bad bacteria in your gut and helps good bacteria flourish. Okay.
Okay.
So I'm going to ask a quick question since you brought this up. How many know the difference between nutritional supplements and herbs as far as what they do in the body? What's the difference? Okay. So this is really important. Yes?
Are nutritional supplements man-made?
Not if they're whole food. If they're whole food, they're not man-made. So nutritional supplements nourish. Okay. Herbs work on function. Okay. So let me give you an example. Let's take a car. Okay. So if we look at a car, the nutritional supplements would be like the gas, the good oil, good gasoline, good oil, good brake fluid, good transmission fluid, good power steering fluid, good lubricants in the joints. That would be the nourishing part. The function, increasing the function of a car would be like fuel injectors, turbocharging the car, giving it a 6-speed, heavy-duty 6-speed automatic transmission. That's increasing the function of the car. So you need both. So herbs increase function. Nutrients nourish. So I generally give a combination of these things. So gut flora complex, berberine, ginger, these are all herbal products, okay? Fish oil would be nourishing, all right? Rutin, nourishing. Glutamine, nourishing. So you really need both to be, and if you're getting over an illness or something, both are really good. So I take herbs every day. I take nutrition every day. So I want to keep my body as healthy as I can. Okay, so here's a question I have. Some of you in here probably know people that are just not healthy, that are sick, that cannot get well. In fact, you may be thinking about somebody like that right now. Who do you know that cannot get better, that's sick all the time? Somebody was in my office the other day, and they were asking me, I don't think it's anybody here, they were asking me about their granddaughter who goes to daycare and is always sick. And I said, well, I suggested 2 things for their granddaughter to take to help their immune system function better. So the question is do you know somebody like that? So a child, an adult, have them call our office. Maybe we can help them get over that. It's not normal for somebody to always be sick, to catch everything that comes along. That is not normal for that to be going on. So a lot of times, just giving them a few things, a few products, and changing their diet can make an enormous difference in their life. Let me give you an example of somebody that came into my office like that. This is a girl that came into me in last April. And she was younger, I would say between 30 and 40. For me, that's young, okay? For some of you, that is too. So, and her primary symptom was chronic allergies. She could not get rid of her allergies. She'd been to a primary care physician. She'd been to allergists, allergy specialists. Been everywhere. What do you think these guys did for her, by the way?
Just give him more medicine.
Pharmaceuticals to treat the symptoms of the allergies. And I asked her, I said, hey, do you have any lab work? Has anybody done lab work on you? Not one of those people did any lab work on her. So that's the first thing we did, the comprehensive blood panel on her. Now, normal liver enzymes are supposed to be between 13 and 26, okay, for the ALT and AST. Her ALT was 200 and her AST was 300. Her liver was basically a toxic waste dump, okay? She had very, very low vitamin D and elevated insulin. How's a body like that gonna work? Can't. So her symptom for that was allergies. So I changed her diet. Did a radical overhaul on her diet. And I gave her supplements to fix all those things. And 3 months later, no more allergies. She doesn't have any more allergies. They're gone because we fixed the problem. We did the lab work and we fixed what we found in the lab work. And now her allergies are gone. Okay. She also lost 30 pounds and she looks a lot different now. So that's an example of what you can do for somebody if you find the cause and you give them the right things. There's a lot of people walking around out there that just don't know what to do or where to go. So that's all I have for you tonight. Anybody have any quick questions before I let you go? Terry.
Back in the early part of the presentation, there was arachnid
arachidonic acid.
Yes.
Yeah.
Arachnids are spiders.
Okay,
Is this the same thing a spider injects into a prey?
no.
Something
Arachidonic acid is what your body turns trans fats and other fats into, that if you have too much of it, creates inflammation in your body. Okay?
Okay.
So you need some arachidonic acid. We all need it. But if you're eating the wrong kind of fat, your arachidonic acid levels go up and you get inflamed. Okay, that's what that is.
Okay.
So you don't have tarantulas crawling around.
Yeah.
Right, just to be clear. Okay.
That
All
was
right.
kind of spooky. That's all.
Anybody else? Okay. I know we're close to Halloween. But... Okay. Yes.
For some of us, like myself as a child, I got like dental fillings, and they were the metal ones, the really not big ones. Could that be a deterrent to someone's health and chronic inflammation all the time?
It can be, yeah, but I don't think they always are, but they can be.
Is there a way to test for it to know if that's leaking in your system?
Well, yeah, what you can do is there are urine and blood tests for mercury. And that's what you'd want to do. You want to find out what are your mercury levels. If they're high, it's a very probable that they're leaking. Okay. But my personal belief is if you have silver fillings and you're eating a good diet and you're doing a lot of things right, you can really suppress the amount of mercury you get. Here's the second thing about mercury that's really interesting. And I just read this. There's some really good research on this, and people ought to know about this. Is that selenium, if you have adequate amounts of selenium, that basically cancels out what mercury does in your body. So selenium is really important if you have, like, if you suspect you have mercury, because selenium can really damp down the effects of mercury in the body. Now, there's a whole thing I could talk about that, but I'm not going to, because I tell people, I'm only going to keep you here a half hour. I've already kept you 5 minutes over. So, but selenium is sort of the antidote to mercury. All right. Okay. Anybody else?
Where do you get selenium?
Brazil nuts,
Oh,
egg yolks. There's lots of different nuts and seeds, but Brazil nuts are really high in selenium. But egg yolks, things like that, have it in it. Actually, tuna, really high in selenium. It's high in mercury too.
Sardines, are they high in?
Yeah,
Selenium?
sardines have
Good.
some selenium. Yeah. Okay. Good. I think we're done. Thank you very much.
thank you.
Thank you.
Yeah.